Health and social problems, just some of the consequences that are faced by adolescents who are exposed to violence. My second guest is Dr. Judith Leiba, Director of Child and Adolescent Mental Health in the Ministry of Health and Wellness. This is the Wellness Beat. Welcome, Dr. Judith Leiba.
Thank you very much, Kediesha. My pleasure.
Happy to have you. We have been talking about exposure to violence and the mental wellness of our adolescents. Is there a sense of safety, would you say, being experienced by our youth population?
Well, I'd flip the question and say a lot of our youth population do not feel safe, especially in certain circumstances. I know that Ministry of Education did a recent study and they said that a lot of the children felt that they were safest actually at school. So in other places, sometimes community homes, they don't feel as safe as, let's say, at school. And we have a recent study which we can explore in terms of what our adolescents have told us about exposure to violence.
And that's interesting, even as you touch on schools, because we know that bullying is something that we're watching, sure, inside of the Ministry of Health, inside of the Ministry of Education. But I think the point is that so many different avenues where our children are exposed to violence. In terms of your experience as a psychiatrist, what trends do you observe in terms of that exposure by our adolescent population to violence?
Okay. So I'd say approximately 3 out of 4 adolescents into youth, because it's age 13 to 24 that study spoke to, say that they have experienced violence at all in their lifetime, their short lifetime. So that's 3 out of 4 persons, right? And 1 out of 2 females that they have actually experienced physical violence, whereas 3 out of 5 males have experienced physical violence, okay? In terms of sexual violence, now, 1 out of 3 females say that they've experienced sexual violence, and that the age at which they experienced it was usually age 13 and younger, 1, and 2, it was usually by friends and neighbors, right? Whereas in terms of sexual violence, the boys said the rate is 1 out of 5 boys. So sometimes we don't think about sexual violence on boys, because boys who have been, like, say, sexually abused, usually you don't want to disclose, they don't want to come to the clinic for help because they're going to be labeled as homosexual. So they suffer in silence, right? But the study, which I will mention now, it's called the Violence Against Children study, VAC study. It was spearheaded by UNICEF and a number of other partners, and it was done in 2023. So that revealed a lot of interesting points about violence. So 1 in 5 boys said that they had experienced sexual violence. Now, their perpetrators were not friends or neighbors. It was usually an intimate partner that you know, would occasion this violence on them. Yeah.
And it's interesting that you call attention to that, because my talk earlier in the segment was with Rory Roberts. He's the center manager for the Kingston Teen Hub. And he himself pointed out that there were young boys, of course, who were among those offered mental health screening and counseling through the Teen Hub. And he was driving home that point for us to be very much aware of our young men and
sexual violence.
Violence.
And it can be from like older boys, so it can be from a male, or sometimes it's older women who initiate these boys sexually without the boys really being ready. You understand?
Wow. The statistics are startling, Dr. Leiba, and there's so much that our children are exposed to. You may have answered this question likely in one of your earlier responses, but I still want to ask, where are our children and youth most likely to first experience or be exposed to violence?
Okay. Well, in home and communities. Okay, well, they spend a lot of time at home.
At home.
And they spend a lot of time, of course, in their communities. And as I said before, a recent study showed that a good amount of them feel safe at school. So then we're looking at home and communities. In fact, 2 out of 5 of this group said that they had experienced violence in the home as a child. And 3 out of 5 said that they had experienced violence in the neighborhood or their community. So it's home and community.
It's home and it's communities. And these are spaces that they should be feeling safe.
Yeah.
But we have a problem on our hands.
Yes.
So if we're in this space, in our communities or neighborhoods, and we come across these children or adolescents, what are some of the indicators that they have been exposed to violence? What will we see? What have you seen?
Okay. Well, the first thing is that children who have been exposed to violence, after a while, tend to perpetrate violence. So, for instance, you may go into a community and a lot of the boys want to become gunmen because they have seen their father shot down by a gunman. And that is the way that they're going to get back revenge, the anger they feel, the distress that they're feeling from not having a father, right? So eventually, and then at school, they may become more aggressive and so on and so forth, right? So the perpetrators, they may become perpetrators. Then we have the trauma-related disorders where, you know, the vision or the memory of what has happened before, you know, witnessing maybe a violent scene, witnessing your father being shot down keeps on coming back to you. It interrupts your schoolwork, it interrupts your ability to study, it makes you angry and aggressive at school, so it affects your behavior.
It's like a tape rolling in the mind.
Right, yeah. So so those mental disorders, sometimes it's depression, plus anxiety, as I said, plus the trauma-related disorders. For girls, the sexual abuse, let's say the sexual violence, a lot of times they don't disclose it. So it's like internalized, and then the depression may lead to like suicidal ideation, and sometimes they may risk, you know, attempting suicide. So all of that. Then we have to think about substance abuse, okay? The pain that they're feeling, the aggression. I recently met a young miss and she said that from maybe 13, she was smoking ganja. Why? Because she's very aggressive, and when she smoked the ganja, it calms her down, all right? We didn't get much further than that, but I'd want to dig into why you're so aggressive. What, you know, was there some sexual abuse that you have not disclosed and you're trying to deal with on your own, right? And then flip side, the boys, well, they may smoke the ganja, but alcohol as well, you know, may be a way of assuaging the pain.
Yes.
Or sometimes the anxiety, right? So you're talking about now substance abuse.
Right,
okay?
right.
And then we're thinking about physical problems.
It's a long list, Doc.
It's a long list. It can go on forever and ever. The physical problems, we get a lot of information from our injury surveillance at the A&E departments. And we've had reports of that, you know, how many injuries take place and what age group and who does it. And when you hear the police statistics, you know, a lot of the, let's say, murders or violent crimes is the kind of younger age group. So again, that is cementing the fact that violence exposure may lead to
perpetrators. Yeah.
Right? And then, as I said, the physical problems, for instance, being raped, you can get a STI, you can get unwanted pregnancies, teenage pregnancies, you know, and all the different injuries that may disable somebody, disable a teenager or a young adult in the prime of their life, you know, who is expecting to, you know, blossom into a productive adult. And
so it just cuts their sense of purpose, the sense of the meaningfulness behind living and acting as a productive member of society.
Yes.
This is such an important topic, Dr. Leiba. And of course, I know the Ministry of Health and Wellness continues to prioritize mental health. What are some of the things that the ministry is doing to address this issue, adolescent mental health?
Okay. Before we go there, there's another spin-off. The teenagers who have been exposed to a lot of violence, they have something called a sense of a foreshortened future.
Right.
So they say to themselves, by age 25, 29, I'm going to die anyway.
Yeah.
So let me just live it to the max.
Yeah, nothing gonna happen for me. Might as well.
Right, I'm going to die anyway, so what? Right? So sometimes when we look on and we feel that they're reckless or they don't care about life, but basically that's the conclusion they've come to because there's so much death around there. Okay, so why you're asking what the ministry has been doing? Well, first of all, we've been stressing the need for child and adolescent mental health, the importance of that,
yes,
particularly in the childhood and the teenage years. I've said this before and I'm going to say it again. WHO teen facts shows that about 50% of all mental illness emerge at about age 14. But these illnesses are not diagnosed or managed until about 10 years after. So from 14 to 24, this person is struggling with this mental illness. They can't study well, they can't form a good, relationship with maybe a partner very well, they can't do well at their jobs or get their career. So a lot of their development is hampered if the mental disorder is not dealt with, right? So that's, so we are stressing that. We're trying to reduce the stigma so persons will seek help,
yes,
right? Because a lot of the problem is that they don't want to seek help, especially teenagers. They don't want to feel different from other teenagers.
Right.
They don't want to fit into the crowd. They know that they're feeling something different. So who do I talk to?
Mask it.
Right, and they mask it, right, until it kind of explodes, okay? So we want to, we have an anti-stigma campaign called Do Your Share. Yes. So we've been, doing like PR schools, stuff like this. We've been going around to schools, doing school activations. Our Minister Tufton has come with us as well, where we do a program in terms of trying to destigmatize mental health. We have a Jamaica Move, so we want to link in the kids' brain the connection between mental health and physical activity,
right,
and that synergy. And we usually give them a wellness bench.
Right, you have been going into the schools with the wellness bench.
Right. So, that has been a success, because people don't think of mental health as kind of sexy, if you allow me to say that, right? So we're trying to make it a little jazzy and fun,
yes,
right? And
yes,
that's what those are for.
And you're driving home the importance of taking a break, recognizing when something is wrong, recognizing when you are not at your best. And it's a message that we need for our youngsters.
Right, and finding a safe space.
A safe space, which is an excellent way for us to wrap up the show. We've been talking about adolescent mental health on this episode of The Wellness Beat. My guest, Dr. Judith Leiba, Child and Adolescent Health Director inside of the Ministry of Health and Wellness, a noted psychiatrist, and we're happy to have her with us. Thank you so much, Dr. Leiba, for being with us.
My pleasure.
So we hope that you continue to watch our episodes, The Wellness Beat, and we're so thankful that you are able to join us. I'm Kediesha Watkis. Take care.